Hi, I'm Kathy B, and I'm here with Dr. Matthew Rowe, an upper cervical chiropractor. And I have a question for him. I was at the gym this morning, and there was a guy that I met that was working out, and he said he had a lot of lower back pain and his sciatica was bothering him. And I've heard of sciatica, I've heard it over and over, but I really don't know what it is and how upper cervical may be able to help. So, Dr. Rowe, what is sciatica, and how can what you do help somebody that's suffering from a sciatica issue?
Well, what sciatica is sciatica. The sciatic nerve is the largest nerve in the body. It comes from the low back, and it's a number of branches of nerve from the low back, and it comes and runs down the leg. The sciatic nerve is like a giant rope. The sciatic nerve runs through the hips and passes through muscles in the lower back. And when that nerve becomes inflamed because the low back is out of position, because the muscles are in spasm, they call it sciatica. Sciatica, some of the common symptoms are pain in the low back, pain in the buttocks, pain down the leg, into the foot, numbness and tingling in the lower leg. More often than not, sciatic is pain in the back of the leg, the hamstrings, and it's very, very common. Sciatic usually is you see it when someone suffers from low back pain, and sometimes you can have chronic low back pain that will turn into sciatica, but it can be an acute condition too, like working out, maybe you squatted too much one day and you threw your back out of alignment.
Okay, and so with your technique that you use, how would you treat somebody that has sciatica?
Well, as an upper cervical doctor, our primary focus is the upper neck and the head. The head sits on the atlas and the axis, which are the top two bones of the neck. And the intimate relationship between the head and the neck controls the rest of the spine. If the head is not sitting center on top of those two bones, what happens is it throws the whole body out of position. Your head is like a bowling ball, 8 to 14 pounds, sitting on top of a little broomstick. And if that head's leaning off to one side or the other, what happens is the brain kicks in. It's got a reflex called the righting reflex. We don't see a lot of people walking around with their head to the side, but what we will see is one shoulder higher, one hip higher, because the brain wants to be level to work properly. So it's this compensation that goes on throughout the body with the shoulders off, the hips rotate, ultimately causing one leg to even be a little bit shorter. Most people that come into our office walk around with a leg that's half inch, 3/4 of an inch shorter than the other, and they don't even know it. And it's this over time that causes wear and tear on the low back, causes wear and tear on the body, and it can cause our joints and our low back to wear out.
Well, that makes a lot of sense. So even if somebody doesn't have any symptoms, would they benefit from coming and getting an adjustment?
Absolutely. One of the analogies I like to use is our bodies are like our tires on our car. If our tires on our car are aligned properly, then we should get the full life out of those tires. But if you're driving and you hit a pothole or you hit a curb, what happens is those tires get knocked out of alignment, and then they don't wear evenly. One might wear out before the other. And it's the same thing with the body. If you're playing sports, or if you're a child learning to walk and ride a bike, the birth process, if you have a slip and a fall, the chances of those traumas knocking the spine out of alignment are very high. So if the head and neck are off, the whole body can be off. And the way we correct it, it's very simple. We just get the head and neck aligned properly, which will cause the rest of those compensations in the spine to straighten out, which will cause the spasms to relax, and it will cause that sciatic nerve, give it a chance to begin to heal, because it's the inflammation in there that's actually causing that pain. So it's one of the most common things we see. That low back and sciatic pain are way too common, and we see them all the time, and then it's because of the way we address things that we see such great results with it.
So can you only adjust adults or kids too young for that? Or?
Oh no, absolutely. We see adults, we see kids, we see babies. We check a lot of babies at the birth, right after delivery, because that birth process can be pretty traumatic. Adults usually tend to have sciatic and low back pain more so than kids, so we see a lot of kids on a preventative basis.
Makes sense.
Just to make sure that we don't, they don't grow up to have the problems that we have.
It's like taking your car in for the maintenance.
Exactly.
And sometimes I think we take better care of our cars, our vehicles, than we do our bodies.
Yeah, we freak out about the check engine light when it comes in our car, but when we start feeling pain, or we start getting allergy, or we start running fevers, or we just start, having these symptoms in our own body, we'll put them off, or we'll do something to cover them up. But that's like putting electrical tape over that check engine light and just keep driving.
Right.
Eventually that engine's going to blow up, and that's what happens with the body.
Yeah. Well, thank you very much. I think I'm going to go check my engine and get adjusted. Always a pleasure.
Thank you.